So in this video, let's talk a little bit about what a neurosurgeon would go through to become a neurosurgeon. Like, what is the training? What have you done to have that distinction, and to be, what does it take to be a neurosurgeon? So to become a neurosurgeon, you would graduate from college and go to medical school. And then in medical school, I think, start to have, and all of the medical school students do this, they start to decide what specialties they're interested in. I did a few neurosurgery specific rotations when I was in medical school, where I spent an entire month on a neurosurgical service at my home school of Iowa. I went to the University of Utah and did a month on the service there. And then I went to a lot of other neurosurgical kinds of meetings and rounds and things through my medical school training. And then I applied in my fourth year of medical school to neurosurgery residency. There are in the United States about 115 accredited neurosurgical programs with roughly 210 or so positions. And I think these numbers fluctuate a little bit year to year. But it's a competitive residency. So in order to match into a neurosurgical program, you usually have to have pretty good grades, have good letters of recommendation, and a variety of other things, research, things that they look at. The residency programs now across the country are 7 years. And when I was in my training, our program was 6, and there were a few programs in the country that were 6 years, but the vast majority of them are 7 years. During the first year, you're usually doing off-service rotations, like in general surgery, neurology, ICU, and then some on neurosurgery, getting, it's almost like the internship year where you're getting a broad exposure and experience. And then really from then on out, I was doing neurosurgical rotations and taking call. So I would do several months on the pediatric service, and then I would go over to the main hospital on the adult service or trauma. And the day-to-day life during residency would be to help out with rounding on the patients in the hospital early in the morning, and then going to the operating room and participating in surgery all day, and in between cases and in the afternoons and evenings, help facilitate the seeing of consults and patients that needed to be seen. And then sometimes being on call overnight and continuing that through the night. Neurosurgery residency was busy. It was probably 80 plus hours of work per week, week in and week out. We took, every other weekend was off, but every other weekend was also working, so it was busy. And during this intensive training process, what ends up happening is you're involved in some capacity in taking care of patients with the attending neurosurgeon nearby and helping you. And as the skill set developed, the attending neurosurgeon would recognize that you had the ability to do more and more and more. I often thought about these surgeries as you would work at the bookends of the surgery. You would help position, you would help prep and drape, and maybe you could make the incision and the initial dissection. And then maybe you were over your head, and you would watch the rest of the surgery, and then at the end you would help with the closure. And then gradually you kind of began doing more and more and more of the different surgeries to a point where you could do them more or less independently. And that's the process with all of it, and it just takes a long time to get there. Once I was done with residency, I moved from Indiana to Utah and began practice. And even in practice, I think there's still a learning curve that occurs. There's a much higher level of autonomy, but it's nice to have some mentorship and colleagues to bounce things off of, and I certainly had that in the first few years of practice. and still rely on others as I continue to learn and grow. I performed or was involved with about 2,000 surgeries in my neurosurgical residency training, which was wonderful, and I was fortunate to be in a very busy center. And then in my practice the last 7 years, I've been averaging about 600 surgeries per year, so actually I've done more surgeries now in practice, but it's a process to get to a point where you feel like you are expert at this, and just like any a difficult thing, to become expert at it takes a long time. So to become a neurosurgeon really is a matter of a long time and lots of hours, but it's been a wonderful journey for me. One other step in the process is there's several exams that occur to test your progress, and the final exam is the board certification exam. It's an oral exam. Interestingly, in my case, because of COVID, I took my oral board exam, probably the most important exam of my life, in my home's guest bedroom on a Sunday morning over Zoom. It was a very intimidating experience. The examiners were awesome. They were delivered an excellent exam. It was tough. And then, fortunately, I passed that, became board certified. And that's the overall scope and training of a neurosurgeon in the United States.